I'm Gordon Taylor. I'm Chief Executive of the Professional Footballers Association, the Players Union, and I've been with the PFA since 1980, and prior to that I was a footballer from 1960 with Bolton Wanderers.
When I met Mr. Taylor, it was quite evident that he had severe knee osteoarthritis, and he had waited a long time because he didn't want to have surgery. He wanted to delay it for as long as possible, and also he had high expectations of what a knee replacement should achieve for him.
I'd have to say with Mr. Kim, it gave me a great deal of encouragement. He's enthusiastic, he seems to be very confident knowing what he's doing, and he convinced me that it would be okay.
The benefits of the Navio robot-assisted technology is less soft tissue trauma, and for the patient it means reduced levels of pain afterwards, reduced requirements for analgesics. It's reflected in reduced length of hospital stay, quicker return to day-to-day function, and quicker return to work.
Immediately I was pleased, with the scar that was there, and after 2 nights staying I was okay. I could get up and down the stairs, and then I wanted to get going, and that's exactly what I've done.
Working in BMI The Alexandra Hospital, for me it's a wonderful place to work, because not just do we have the great ambience that we see around the hospital, we've got state-of-the-art facilities, but the BMI Alexandra Hospital has the ability to attract and retain very able and dedicated staff. And I mean staff from nurses to physiotherapists, to physicians, radiology colleagues, and paramedical staff, which are essential to my practice as a hip and knee surgeon.
I've always liked the Alexandra. I've always felt comfortable, I've always felt at home, I've always felt they know what they're doing, the staff and everybody.
In addition, the hospital has intensive care and high dependency units to support me in treating high-risk patients, and I think that's very important.
I think coming from the parents I had, we've always had some northern grit and resilience, and saying, yeah, this is life, come on, it's to enjoy, get on with it. And it was the same approach with regard to my operation, and it was the type of confidence I had in the hospital and in Mr. Kim, and that's worked out very well.